But that is not stopping Republicans from arguing that the law poses a threat to the economy. Let's get into a fair and balanced debate with Mary Catherine Ham. She's editor-at-large of HotAir.com, also a Fox News contributor. Ryan Clayton is a Democratic campaign consultant who has worked on the campaign trail for 10 years. Mary Catherine, to you first. This thing is settled law now. The Supreme Court says it's okay, so why bring it up again? Republicans have tried to repeal it before, and it has never succeeded.
Yeah, I mean, this is part of their goal. This is the democratic process. It was passed, but 52 to 53% of the American people consistently, since it has been passed, are partly for repeal or for entirely having the thing repealed. And look, repeal is not so extreme. I'll explain why. The president himself and the Democratic House at times have actually been in favor of repealing different parts of the Affordable Care Act, because the Class Act and the 1099 revision or reporting requirements were so onerous and so badly written that they had to be on board with repealing them themselves. So this is what happens when you pass a giant piece of legislation. There are parts of it that don't work, and there are many American people who are afraid of what's going to happen, and the Republicans have every right to bring this forward. And it'll be one of the more, it would be more bipartisan than any vote made to pass the thing if several Democrats get on board. So there you have it.
Ryan, yes, the Supreme Court said, you know, it's settled law. It's okay for this thing to stand. But the Chief Justice, who wrote the majority opinion, said it's not necessarily our job to decide whether this thing is any good or not. We just decided that it is legal to uphold it. What's your response?
Do Republicans really want to go into an election year arguing that they want to bring back pre-existing conditions? Do they really want to argue that women should pay more than men for the exact same health care? Do they really want to kick off 20-year-olds off their parents' health insurance in an election year? I mean, these are the things that Obamacare fixed. It's why they passed the law, and it's why the Supreme Court upheld it as constitutional. And if the GOP and Republicans want to do some research, it's also why their candidate for president test marketed this law when he was governor of Massachusetts.
All right. So, Mary Catherine, what about it? There are some things about this law that people like.
Yeah, there are some things that people like. I think many people concede that, but it's a, $900 billion to $1 trillion bill, and you have to answer for whether it's working. It hasn't worked thus far. Premiums have gone up. People are afraid of losing doctors. Doctors are saying, look, if you dump 15 million more people on Medicaid, it's going to be problematic for us because we're already not able to treat all the people there. So giving people a giant bill with a little card that says the government's helping them to get care does not necessarily mean you're solving people's problems. If you were solving people's problems, then 53, if people's problems, Ryan, if people's problems were solved, 53% of them wouldn't be for repeal of all or part of this bill. You have to answer for that. You can say that a couple parts are good. I can also say that the whole thing is a giant boondoggle that costs $1 trillion, and if it's not going to work for people, then they should have the right to address it through their elected representatives, which is what they're doing, which is what they did in 2010 when they elected a Republican House.
Ryan,
if an American's sick, they should be able to see a doctor, I think it's just that simple. I don't know why Republicans are standing against Obamacare, because they're standing on the wrong side of history, quite frankly.
But that was
the case. Well, they're standing with 53% of Americans.
Before the law, Ryan, in emergency rooms, for instance, were required to see anyone who showed up at their door. It's not like people were being denied all access to health care just because they didn't have health insurance.
I agree, but I also think the preventative care is something that everyone should have access to. Most Americans want this. If your neighbor's sick or their kid's sick, they want them to be able to go to a doctor if they're hurt or if they're sick. I don't know why Republicans keep standing in the way of this law that most Americans want. Most Americans want everyone to be able to go to a doctor and to get care when they need it.
But as Mary Catherine pointed out, the polls have been largely against. I mean, Obamacare, and the numbers have been growing of those opposed to it since the thing was passed, Ryan.
Well, Republicans are standing on the wrong side of history in this instance, because many years from now, Obamacare will still be the law of the land, and millions of people will be free of the oppressive burden of illness, injury, and disease because of it. And that's what this law is about. It's about freedom. Freedom from the want of health care for your friends and family. Freedom from the threat that an illness will bankrupt your family. The freedom to change jobs and the freedom to start a new business.
Mary Catherine, go ahead. Final thought.
I would like to be free of the thousands of bureaucrats they're going to add to the healthcare system to actually write what's in the law. Ryan can't tell you what's going to happen to the millions of people that the CBO has said will lose their employer-based health care that they like, that the president said they would never lose. He can't tell you because bureaucrats are still writing the law. Just because you pass a giant law doesn't mean you have succeeded in solving problems. The American people see that. I understand that Democrats in Congress and in Washington don't understand that, but they have the right to address this. 70% of,
Okay.
I think the best polling numbers on health care are for modest changes, not this giant thing that they passed that nobody likes.
Mary Catherine Ham and Ryan Clayton, good discussion. Thank you both.
Thanks for having us.
Crash.